Today, we are excited to welcome Angela Newman-White, Executive Director, First Year Cleveland. Angela has over 18 years of public health experience focused on addressing inequities in maternal and child health. Her previous role as grant supervisor at the Cuyahoga County Board of Health included the establishment, oversight, and coordination of various maternal and child health programs, services, and initiatives since 2011. Prior to this role, she spent 6 years with Moms First at the City of Cleveland Department of Health. In addition to participating on local and state collaboratives, in 2019, she was elected to the City Match Board of Directors and appointed to the Cuyahoga County Department of Children and Family Services Advisory Board. She was named a Changemaker in 2024 by Collaborate Cleveland, and we are proud to have her as a member of our Advanced Leadership Institute class of 2025. Please welcome Angela.
Thank you so much, Rachel, for having me today. I'm going to share my screen to keep me on task, because if you haven't found out, First Year Cleveland has been so busy lately that it's sometimes challenging to just talk about it because it can go on forever. So the PowerPoint helps me to stay on. So let's see, do I have this as okay, good. Okay, so I'm here today to just talk a little bit about First Year Cleveland, why we exist, and some of the work that we're doing in about 15 minutes. So I apologize if I speak quickly. But if you don't know, we were established in 2015, originally housed at the Case Western Reserve School of Medicine. This was in response to the high infant mortality rates, and the city county government decided we need a large backbone organization to help to kind of better convene all of our partners and identify some upstream strategies to support families. In 2022, the organization shifted over to the School of Applied Social Sciences, which I was excited to hear because that's an opportunity to elevate the importance of social conditions on infant mortality. And First Year Cleveland 2.0 kicked off in January of 2023 when I took over as executive director. I'm pretty sure most of you know, just in general, the infant mortality rate is the rate of deaths per 1,000 live births. It's an indicator of how well we're doing. And if you haven't been under a rock, you can know that we in Cuyahoga County, in the state, really in the nation, are not doing well. Unfortunately, Black families are more than 3 times as likely, sometimes 4 times as likely in particular communities to lose their babies than white women. And we've had an ongoing disparity, honestly, since before I've gotten to this field, which was about 20 years ago. The county overall is faring okay with the Healthy People 2030 goal of 5 deaths per 1,000 live births. We're still, as a whole, not doing well, but as you can see, our 3-year average, our Hispanic and white rate has met that goal. The leading causes of infant deaths are babies born before 37 weeks, and that accounts for about 60% of the infant deaths. And the remainder is kind of split between sleep-related deaths and those babies that are born with birth defects. Birth defects are the hardest, most challenging kind of causal factor because there's not a lot that we can do about it, but there's so many opportunities as it relates to prematurity and safe sleep. I mentioned before the importance of being at the Mandel School is really looking at the social conditions. If health outcomes are mostly predicted by your behaviors and the environment that you live, work, play, and pray in. Healthcare only accounts for 20%, and despite having some of the most prestigious healthcare institutions, I feel like they're on every corner. We still have these unfortunate outcomes for our families, not only in infant mortality, but across all chronic diseases. And if you look on the map on the right-hand side, it kind of highlights where the communities that carry the greatest burden. Richard Stacklin's on our team. He created this social determinants of health index that allows us to have a really data-driven, kind of closer look on where the actual disparities exist. And so this social determinants of health index that highlights the areas in darkest red basically carry the greatest burden, having the highest rates of unemployment, housing instability, transportation barriers. Those communities are also the same communities that carry the largest burden of infant mortality. And it's a standard C that we have seen since the redlining maps. And so we do understand that, yes, we have these social conditions, but we recognize that they are all rooted in historical racism and discriminatory practices that impact all of these social conditions. And it's, there's some examples here with this great, slide that I did not come up with, that I kind of borrowed from someone, but to just highlight, if you think about, how the food is distributed, right? We have to think about where are the grocery stores at, what type of food is being served, and can people afford to actually acquire the food? I mean, we can say that healthcare is available, but we have to consider, what does the healthcare coverage look like? How can you access it? And is the care, culturally responsive and appropriate for the consumer? So First Year Cleveland is, we take this upstream and downstream approach to all of our work. We highly value the importance of the direct service providers, our community health workers, doulas, our clinicians, the folks that are treating the patients. But the reality is if we don't look upstream and do some policy and systems changes, we're just going to continue to pull babies out of the river. We want to keep the babies from getting dropped in the river in the first place. So our mission of First Year Cleveland is to reduce infant mortality. We have updated our language given the new federal guidance. And so we did say particularly among Black women, but we're going to say communities of greatest need. We know that the data does clearly identify Black women as the highest risk. And so that's going to continue to be our mission. But I want to make sure that every baby and every mom is healthy in our county. When I took over, I rebranded us as a connector, protector, and activator. So, First Year Cleveland, though we don't provide direct service, we do support the community organizations that are serving families. We do this through various ways, whether it's funding, capacity building, and training. We center Black communities, Black women in all the work that we do, and we have developed a strong policy agenda that will help to address those larger social conditions for families. The structure of our organization, we just have a very small team of 5 folks in the center, but we have some committees that help to support our work: our executive committee, healthcare committee, and a public policy committee, and a community advisory committee. So they drive our strategies and make sure that we're on track, but we outsource our advocacy and communications work, and we are grateful for the supportive case that provides our, HR, research, and finance. Just some snapshots of the work that we've been doing in the community. So I talked about, our committee structure and how they kind of lead us through our journey. But we do a lot of listening. So it's important to me, and it has been through my entire career, to be responsive. Though I highly value evidence-based practices and intervention, I'm more of a fan of the evidence-informed because, and many of you may know that, an evidence-based intervention really only works with the folks it was tested on. You don't take into account all of the other protective and risk factors going on in a person's life to ensure that they'll be successful with whatever intervention that you are designing. And so we ask people what they want, what they need, and First Year Cleveland responds. So we provide various opportunities to receive information about the why infants are dying, and how we can, focus on a particular topic. We provide, data, local resources, and then a policy opportunity through our community partner gatherings. If you go to our website and subscribe, you'll get all the information on when our meetings are. Our next one is May 1st. And with the capacity building, which I mentioned, is around supporting the organizations through training. We do co-healing trainings, trauma-informed care training. We've partnered with, we have a Safe Sleep initiative, and we've partnered with the County Board of Health to ensure that, because there's consistent messaging across all sectors. All of our services and supports are completely free to the community. And then with our advocacy piece, so our local public policy committee, locally, we're focused on, historically, before this administration, meeting basic needs, maternal, mental health, and paid leave. We've expanded that to be more inclusive of overall housing needs, transportation, and childcare, just knowing that if we don't address these undergirding, inequities, then we're going to have a lot of issues moving forward for our families. And so 2 years ago, I created what we call this Infant Vitality Advocacy Day, whereby we convene folks across the state to come join us and meet with legislators about some shared priorities with our state partners. We work closely with Cradle, Cincinnati, and Celebrate One. We call ourselves the Sister Cs. We're looking for our next one in late September, so you can be on the lookout for that. But that includes more of what's going on statewide. So statewide, we're focusing on housing, um, oh my God, maternal mental health, and also ensuring that there is a framework for reimbursement for doulas and community health workers. Knowing that the doula legislation did pass where they are getting reimbursed, there needs to be stronger consideration of how the doulas are getting certified and the process to actually draw down the funds. It's not as easy as folks are trying to make it seem. And so it's important for us to make sure that we remove all barriers for folks, not only in our county, but across the state to access and leverage these services. So in summary, when we think about the impact of the federal changes, attack on DEI, telling us we can't even say the word woman anymore or pregnant, um, we're working closely with our partners to look at our language to make sure that we are not being we're not, we won't put our eligibility to receive any federal dollars in jeopardy. We also are working on strengthening our partnerships across sectors. The success of First Year Cleveland to date is only because of our strong partners, the partnerships that we have. We cannot do this. We recognize we cannot do this work alone, and we are not the expert in all things. We honor the privilege and experience of all of our partners and continue to build this vast network. We're also looking to, create a framework with our partners at Neighborhood Leadership Institute to increase efficacy around advocacy for our residents. Now more than ever, it's important that we use our voice and we provide opportunities for folks that may not have been engaged in this space to know that they're welcome to do so. And then most importantly, it's focusing on the data. The data does not lie. So the words may change, but the data tells the truth. And so we're going to continue to be innovative in how we think about data, how we report data, and how we use it to tell our stories to make sure that, our families are thriving. So that's in the summary, that is in a nutshell, like what we are doing in the quick and dirty. And and I came in 2 minutes early. This is great. I spoke quickly. And if anybody has any questions or comments or thoughts, I'd be, open to hearing and responding.
Great, Angela, thank you so much. Let's dive in. And you brought up the current climate and all of the change that is happening just so quickly. From your perspective as the leader of the organization, how are you approaching these changes with your team? What kind of leadership lessons are you leaning on to navigate this really kind of rapidly changing gray space?
So I think the first, piece is to not panic, right? Yes, we should panic, but we should not. We meet with our team meets at least weekly, but we're in constant communication about what's coming down the pike. And I think that, this trying to provoke this chaos so folks feel helpless. And that's not what we're doing. We are not helpless or hopeless in this space, but that, women are going to continue to get pregnant and are going to continue to have babies. And there is a space for all of us in this work. It's not going to stop. It's just how we do it. It's like the word may change, but the work does not. And so we're not trying to be reactive, right? We have to wait and see because these executive orders, though they are just not good, that's the nicest way I could say, they still have to go through a process. And so it could be that, yes, this is what it's going to be. But then when it goes through the whole checks and balances, maybe that's not the case at all. So I don't want folks to panic, but we also are planning for the future. We have to be innovative and be prepared to pivot at any time because if we don't, it's going to be detrimental. And I think that from my perspective, the organizations need the greatest support. Our nonprofits are going to be, I think, hit the hardest as it relates to providing services. And so, really leaning on our great network of philanthropy in the community. We have so many great people And so I guess, in summary, I just want us to remain positive and keep going because they want us to stop. This is the intention. And we're not going to do that. So
You mentioned so much of your collaboration and your partnerships. Can you share just kind of who are some of those go-to partners that you've been working with, and how have you been able to kind of successfully build these collaborations?
oh, there's so many. I mean, I can put them in sections. So, of course, we have our maternal and child health serving partners, our direct service organizations like Birthing Beautiful Communities and Pregnant with Possibilities, Moms and Babies First, and Moms First, and Project Milk Vision. I mean, I can go on and on and on. We have a number of consistent partners that engage with us. We also work very closely with the healthcare systems. So, not only on their administration of larger social supports for their patients, but also, trying to identify some strategies within the system that can eliminate barriers for access, but also support implementation of any recommendations that a provider may have based on the patient's health status. We've formed partnerships with our housing partners. Housing is a huge concern here. So we work closely with, of course, CMHA, Eden. We've recently launched a Healthy Beginnings at Home program that provides free housing as part of a research project out of Ohio. And then we've worked with, of course, Tri-C on workforce development for our families. I think we're partnering with everyone. I think that why we're so successful is really because we recognize that we are not the lead on all things. And so this is really a shared approach. And so when you come in with a collaborative spirit without the intention to take over, it tends to work, I think, because all of us just want to support our families in whatever way we can do that, whether it's taking the lead or supporting or sitting back and watching, that's kind of how we God, we work. And we also honor, all of our partners in the sense that they're always elevated. So any opportunity we have to elevate the work of our partners, we do so because it's important that, folks follow different people for various reasons. And our Cuyahoga County is so fortunate to have an abundance of resources, but there's so many that we don't really know all of them. So trying to work on a strategy for that is what we are currently, engaging with.
And can you speak to your funding model?
Yeah, so we have a braided funding model. So hopefully we'll continue to receive a substantial investment from the state Ohio Department of Medicaid, and that funds the direct services. So we fund 9 organizations that provide direct services. We also receive support from our city and county government. So that is a part of the covenant of First Year Cleveland to show the commitment of both the mayor of the city of Cleveland and city council, and also the county executive's office and county council. That provides more of the flexibility to be responsive to what the community partners say that they need to fill gaps that may have been created by some high fidelity models that come out from like federal and state funding. And then we have generous support from our local philanthropic community. And so, the ongoing support, I'm thankful from the Gun Foundation, Mount Sinai Foundation, Cleveland Foundation, St. Luke's, Bruning. So we have various investments range in ranges. And so, some of that prescribed funding, we do direct that to our ODM partners, but we're grateful for the flexibility of the remaining funding that we less than 20% of our whole entire budget is for general operations. 80% goes directly out to the community. Last year, we invested $3.6 million into community organizations. So we're essentially, because we're in a position and we're at K, sometimes we have leverage to get the money, but it goes right back out the door. And so I'm grateful for this type of a structure. I think it works best when you're looking at nonprofits, just to have this diverse braided funding and this commitment from the funders that understand that a braided funding model is one of the most effective ways to be impactful.
How does First Year Cleveland work to educate pregnant moms to be sure that they are aware of all types of different conditions that may affect them, such as things like preeclampsia.
So that's kind of so we don't particularly do a lot of community messaging. Besides our Safe Sleep campaign, that's what the most recent directing our support for parents, because we support the organizations who support parents. So we're doing we right now we have a Safe Sleep campaign. It's called Babies Need to Breathe. And that's got a combination of billboards, buses, radio, television, and we have a safe sleep toolkit for our partners to use to to highlight the importance of the protective factors for safe sleep, because we recognize that people do sleep with their babies. I am currently working with some faculty, and we're launching a qualitative study to really come up with a risk reduction model, because people sleep with their baby. And so we need to acknowledge that. I equate it to comprehensive sex education, right? If you tell kids or young people that abstinence only is it, knowing that they may engage in sexual behavior, that's not good. If you want to reduce, the incidence of unplanned or unwanted pregnancies and STDs, you have to provide a risk reduction model. And so we're looking forward to that. We have a web-based app that my goal is to have it ready to go by the end of the month. It's called First Year Connects, and eventually it'll be a mobile app. And so that'll be a way for consumers or families to actually find services on their own without having to find a community health worker to get the service. But we provide the education and information to providers that kind of trickles down. That was a long-winded answer. Some information is on our website. We do have minimal, but First Year Cleveland we support more of the organizations than we do directly work with families.
As you look back over the few years you've been with the organization, what are some success stories that stand out to you?
All of it. The first one is the transformation. And no, I don't want to. So, previously First Year Cleveland it was just different, right? It resonated different with the community. And it was very clinically focused. And I think that, because of the history that I've had in the community in this space, just the love and support and just changing the narrative from individual responsibility to systems accountability is like a huge success. I think getting people to really understand from a systems level, like we can actually change how we do business, and it's going to reap the better outcome than just trying to tell moms what they need to do. Like, let's make the healthy choice the easy choice. Let's figure that out. And another big success, I think, is the launching of the Healthy Beginnings at Home project. I, was leery in the beginning because it provides finite, 24 months of rent. And we were able to get an agreement with CMHA to guarantee vouchers for these families. So this is the first time, in Cuyahoga County that pregnancy was going to be considered as a priority population for subsidy. And that's the goal statewide, right? Like if we can prove that stable housing improves health outcomes and saves money, why can't pregnancy be a priority? And so so we've got like this little win, and I'm so, excited about that. And I think the Infant Vitality Advocacy Day is a huge success, like for the first time, and it's vitality, right? That's another thing we've done. We're stopped talking about death and focusing more on life and joy, because there's so many great things happening, and just the possibilities are endless. This Vitality Advocacy Day is bringing folks to the State House that have never gone before. The first year it was like 20, then it was like 80. And so I can't wait till what this third iteration is going to be like. And yeah, I'm proud of the work that our very small and mighty team is doing. And, we just launched the healthcare committee. So I'm looking forward to what great work's going to come out of there. I can go on and on. I love what we're
You've
doing.
made
So
some great changes already
yeah.
in your time. So let's start looking ahead 5 to 10 years from now. Where do you want to see First Year Cleveland?
I mean, I want us to be a household name as a convener, and not just the maternal and child health space. I hope that my goal is to make sure that everyone, regardless of what sector you're in, sees themselves in this space, understands that if you're working for a tech company, there's an opportunity for you to either work with your particular organization or to inform some way to better address like barriers with technology or to better coordinate some data collection models. If you're in transportation, thinking about restructuring, public transit and meeting the needs of families. I mean, private business, my gosh, thinking about the value of just implementing a paid leave policy for, your families. I really want folks to understand that I want us to see us at this centralized policy advocacy and fundraising organization that sees all people, that will have a seat at the table.
What challenges do you anticipate in trying to reach that vision, and how can those of us on the call today help you overcome those?
I mean, at the forefront is this political climate. I mean, the devastation that's going to happen is going to be bad, to say the least. So the challenge right now is just trying to navigate this new, I don't even know what it is, this new world. I feel like we're in a vortex. And so we have to be able to shift and move, and I want to protect our families and protect our organizations. And so, you know, on this call, what anyone can do is you got it right now. The state of Ohio is engaging in their budget hearings. Call your representative. Don't email them because they have to respond to every phone call. Call them and talk about, the importance of investing in these larger systems and structures, or even investing in your own particular organization in the governor's budget. This is the time to do that, because if you don't speak up, they're only going to listen to the people that talk the most. And sometimes the people that are talking need to sit down. And so I think it's a great opportunity for all of us to not only engage one-on-one, but there's the budget hearings are the 11th, 12th, and 13th. I mean, you could submit a testimony and you can go on down and speak in front of the Housing and the Senate finance committees, and really, elevate the work that you're doing and the impact on, the budget and the implications of whether certain investments are removed, or the value of investing where it needs to go. So I would just encourage all of you to call your local representatives, and/or, March of Dimes is having an advocacy day on the 11th. It's free and open to the public. You can go right on down and join my partner Bianca at the March of Dimes, and Groundworks is on the 12th. There, if you haven't already registered, you may not be able to go because I think it's closed, but you can go to the budget hearings or listen in on them. So,
Angela, we have time for one final question. You have spent a large majority of your career in the maternal and child health space. What have you carried with you? What have you learned along the way that is helping you in your role now?
I mean, it's what I've always led with, that we're stronger together. I think that, a lot of the issues that that Cuyahoga County has is people operate in silos, and whether it's intentional or not, there's a lot of competition. And I just feel like, I just lead with, you have to put your ego aside, and we've got to honor each other's strengths and accept each other's weaknesses and our own weaknesses. And just, collaboration is the only way. Any type of social movement, which we're going to need one here soon, it requires all hands on deck. And regardless of how you identify, your gender, your race, your religion, it's impacting us all. And I think that if your heart's in a good place, come to the table. And so that's, I'm just a collaborative lady.
Well, Angela, we thank you for everything that you, your team, and your partners are doing in our community to help address such a challenging issue. And we wish you all the best and encourage everybody on the call to use your voice and advocate and reach out to Angela to learn more.
Absolutely. Thank you so much.